Today, thousands of people are caught in the middle of a contract fight between UConn Health and Aetna, and now the health system is considered out of for many patients with Aetna insurance.
Our colleague, NBC Connecticut's Matt Austin, is live in Farmington with what you should know and what's being done to potentially prevent this from happening again. Matt.
Yeah, so Amber and Kevin, after months of negotiation, UConn Health and Aetna have failed to reach a deal. So what does this mean? It is a lot of frustrations and uncertainties for what we're told are 15,000 patients who are affected.
You're using patients as a football for negotiation tactics, and that's absolutely wrong.
State lawmakers say they're already hearing from people concerned about their health care. For many Aetna members, UConn Health is out of network as of yesterday.
What's happened is that the insurance industry has been very heavy-handed. What they say is that if you're not going to agree to our terms, we are going to actually eliminate the ability of you to provide care to our members.
The change can mean patients having their appointments canceled, finding new providers, or paying more. In a statement, Aetna says while negotiating a new contract, UConn was asking for significantly higher reimbursement rates, and that would increase costs for patients. It wrote in part, Aetna has engaged in good faith efforts to reach a fair agreement that keeps healthcare affordable for our employers and members. UConn says the rates it receives from Aetna are much lower than those of other health systems in the state. In a statement, it wrote in part, we remain hopeful that Aetna will return to the table with a fair, sustainable proposal so we can restore in-network access as quickly as possible. UConn says some patients can qualify to continue their in-network rates for a limited time, and emergency care is always covered in-network. With these health coverage battles seemingly happening more often around the state, there is bipartisan support for the legislature to step in.
Remove the patients from the negotiations and don't make them liable and don't hurt their care in any way.
We'll keep pushing to try and make sure we protect our patients in our state when people fight with each other on money.
Now, one idea lawmakers have is for patient care to automatically default to in-network for as long as it takes for the insurance company and a medical group to hash out a new contract. Live in Farmington, Matt Austin, NBC Connecticut News. Kevin, back to you.
Matt, thank you.